We're often asked by prospective applicants what makes Henry Ford's Radiology Residency program unique.
Our staff are a reflection of our work environment, and I think the people that we work with, our attendings, are really happy in their workplace, and I think it is really important as residents to be able to appreciate that and to work around it.
Our residents, with not just becoming competent radiologists, they can become educators, they can become researchers, so they can choose. To me, that is one of the real strength of this training program, that the resident can choose whatever they want to become.
Academics and research is a fundamental part of our residency. Henry Ford Hospital's hybrid approach to medicine, where complex clinical care merges with education and research in a community setting, opens the door to unlimited academic opportunities. Whether teaching medical students, doing research, or presenting at national meetings, the radiology department provides residents with the support and infrastructure needed to be successful.
I have a unique perspective, I think, on radiology residence and board training. So I'm a formal oral board examiner, which is what we used to do before written boards, and then I was also a question writer subsequently for written examiners. We teach people here to be great radiologists. We actually don't teach you to the boards. We don't teach how to pass boards. We teach you to be a great radiologist and you pass the boards. Because our focus is not about the nuances or trivia that sometimes show up in examinations, but to teach you to be a good radiologist. And our 100% pass rate on the current written exam, since it started several years back, I think reflects that.
We have great one-on-one teaching, and we have great opportunity for research. And my, being a European in birth and an American at heart, for me to have come here, Henry Ford has let me play with what I really wanted to do is bringing in musculoskeletal radiology, bringing everything together. We do X-ray, we do CT, we do MR, but the fact that now I can come out of my reading space and enter the patient space and do ultrasound has really been my enthusiasm. I have done that for 30 years and I'm still doing it and I'm still loving it.
I just think that the residents kind of echo the whole feeling of the department in that they really care about education as far as educating one another, really being a mentor to the junior residents, like when you get to be a senior resident, and then also to the medical students in the department.
The sheer volume of the cases, we have this incredible clinical database that we can mine to do research on. At the end of 4 years, some of them become excellent researcher, a clinical researcher.
We're actually in the middle of a research project that our department is doing with our division and in collaboration with MIT for looking at AI and the use of reading screening mammograms. So I'm so excited about that because AI is here. It's here to stay. So we can't put our head in the sand and think that it's not going to happen. It's here, and it's how we decide to collaborate with it to make our interpretations better, and it's exciting. Every day we keep pushing the bar in how we approach breast cancer screening.
So one of the really exciting things about research in radiology and research in imaging here at Henry Ford is that imaging is at the center of everything now. Whether you're doing research in cancer, whether you're doing research in orthopedics or cardiovascular or neurosciences, it all involves imaging. So much comes through radiology, and we have the opportunity to be at the beginning of this, from the project design to how the images are actually acquired to how they're interpreted.
The clinical environment at Henry Ford, both in terms of case volume and case complexity, rivals that of any institution in the country. Our radiologists are all part of the Henry Ford Medical Group, which is one of the country's largest medical groups, ranking in the 99th percentile of all group practices for clinical care. So what does this mean for our radiology residents? It means being part of a collaborative team of physicians, providing state-of-the-art diagnostics and treatment, and most importantly, it means being on the leading edge of imaging and therapeutic innovations.
The volume and diversity of cases we see here is absolutely amazing. My division of abdominal imaging has 19 staff physicians, which is larger than some departments. We see an enormous volume of cases pulled in from Metro Detroit into the suburbs, where we do a lot of primary care for the community, but still bring in a lot of tertiary, high-end things from really not just Metro Detroit, but outlying in the state.
I think our procedural training is honestly second to none, because you're getting to do it with people who do 100% of that subspecialties procedure. So it's not just a generalist or anything like that. And you'll do it on those specific rotations when it's, when it's a musculoskeletal biopsy or anything to do with the extremities, you do it on that service. When it's a abdominal drain or biopsy, you do it when you're on that service. And then when you're on the interventional service or neurointerventional services, you're doing kind of all high-end procedures. So you get that procedural experience throughout the whole year. It's not just bundled into a single month. It's very hands-on. There's limited fellows compared to the number of residents, and so almost universally, if you're the resident on that procedure service for the day, it's just you and the attending, and you get good autonomy early. And I think that really leads to confidence in your ability to do procedures and go forth and do them.
From the days of the hospital's founding by Henry Ford himself, innovation and community outreach have been centerpieces of both clinical care and education. And today, you can see both of these in the department on a daily basis. Whether it's in research or patient care, using the Simulation Center to enhance resident education, or global outreach through our RadAid chapter, there's a constant drive to be innovating and helping others.
Well, our department has been involved in global health outreach for many years now. Back in 2013, we started a chapter of RadAid. RadAid is a national organization that's focused on bringing sustainable imaging to the developing world. And so through RadAid, we've done a lot of national and international projects. When I was a resident here, we traveled to Nicaragua. We've actually gone there twice. We have also gone to Peru, Ethiopia, and we even had a physicist go to Grenada. Most recently, in the last year, we've just started a partnership with a children's hospital in Laos. We're working on a lot of education there. We do case consultations, training the sonographers. So it's a really interesting opportunity. We also do initiatives with other groups. So we have a project with Kenya Relief. They're an organization based in southwestern Kenya, and we have traveled there 3 times. There's our 4th trip upcoming.
The residents spend about a month with us in pediatric radiology, and then in their 2nd or 3rd year, or maybe even in the 4th year sometimes, they go to Children's Hospital where they spend about 3 months. They do very well because they already have a little training with us to start with. We have recent technological advancements in the computer age, and this is one of those. This is one of those innovations where we're actually using the computer and the mannequin, which have been programmed with different scenarios, to train the residents. So they're not making mistakes on live patients, they're learning from the mistakes on the computer, on the mannequin.
More important than anything, though, is the environment you'll find at Henry Ford. Our goal as a department and residency program is to provide a collegial and supportive atmosphere that enables a diverse group of residents to excel. And what's the key to creating this environment? It's the people within it.
I think what makes it great, though, are the people. It's just a good, caring environment. You get what you need as far as education, the training, and the experience, but it's not done in such a way that you are overworked and don't have time for family or can't make time for the important things in your life. Many of my co-residents were able to get married and start families without any difficulty or delay in their training. You're able to kind of balance the things you need to balance and get to the places you need to get to as far as your career goals.
Detroit became a destination. It became a foodie city, a destination. You want to go down to Detroit. I live in the suburbs, but I spend my time on the weekends down in Detroit. We come here to eat. We come here to go to sporting events, to plays, to hang out. It's really a great place with a great vibe.
When our residents leave Henry Ford, they should be able to walk into any practice setting in the country and be successful. And our commitment as a residency program, department, and faculty is to ensure that every single one of our residents meets that goal. My name is Brent Griffith. I'm the Program Director of the Diagnostic Radiology Residency Program at Henry Ford Hospital, and I look forward to meeting you.